Good afternoon. I'm Jan Smolowitz. I'm the Dean at the School of Nursing, and I will be substituting today for Dr. Joan Vallis, who is the Program Director. I'm happy to answer any questions, and I'm pleased to be able to speak with you. I will tell you all in advance, this is about the Pre-licensure MSN Entry to Practice Degree Program. I am talking from home today, and I have a bunch of dogs who live with me. And I just figured out that what they don't like is the sound when everybody enters the Zoom meeting because they keep barking at it. So hopefully they'll give me a little bit of rest and peace and quiet for the moment. So thank you and welcome. So again, we're here to talk about the Master of Science in Nursing pre-licensure program. Whenever we talk about master's degrees and nursing, there always has to be a specialty beyond the entry to the registered nurse and to the profession. So in this case, we are doing what's called specialty in care coordination and transition management. And just to give you an idea what that means is, as we know, people are living longer. They're living longer with more chronic illnesses and are being assisted by more technology. So we know, therefore, that we do know they are admitted to the hospital, they have more chronic illnesses, and our goal is to always keep people healthy in community. So what someone with a background in care coordination and transition management is it's an additional amount of knowledge of understanding how to transition people across settings over time into the community. I personally think that this kind of education is incredibly important for everyone who's a registered nurse. But we do see it as people advance in their careers in terms of being case managers and other types of work in that genre. But again, basically really important just for nursing in today's society. So let's get going. I'm joined by Christopher, who's helping me today. In terms of the School of Nursing, we are relatively new. We began in 2016. We began with a registered nurse to BSN degree program. And I think we've graduated 3 classes at this point. We have a generic Bachelor of Science in Nursing program. So that's your traditional from high school to college program. And our first class will be graduating from that program this May. In 2018, after speaking with graduates of the RN to BSN program and hearing about their needs, we did create the Master of Science in Nursing post-licensure program, and that's an online program. And with that, there is a bridge program for people who have bachelor's degrees in other fields, went back, got an associate degree in nursing, and now want to progress to the next level. So that deals with their needs. And this year, we started our Master of Science in Nursing, the pre-licensure program. So we normally start a cohort for that in spring, but due to COVID and everything, we moved it back to the fall this year, because again, we're trying to keep everybody safe as we go through this program. The next class that we admit, all things being good, we will be admitting in summer of 2021. Summer means May. Okay, next screen, Christopher. So I want to tell you a little bit about the pre-licensure program. It is full-time, okay? Now what that means is that during the fall, the spring, and the summer semesters, you can expect to be carrying anywhere from 10 to 12 credits each semester. During the winter semesters, you will probably carry 3 credits, okay? So this is year-round, it goes continuously, and it does require full-time attention to it. It's really difficult to work through this kind of program. Okay, the program is 63 credits. It's 63 credits because you are actually completing the work required for a professional degree. Courses are given online for didactic as well as hybrid. And hybrid can mean that you may have part of the work online that week, and then you may be coming in to go over things in the simulation lab or working in a classroom. Depends on how much. And again, it will depend on what is happening with the environment and the health of New Jersey at this point and the nation. There are in-person courses. Obviously, all the clinical work is in person. And when I speak of clinical, I'm talking about the work that we do in the hospitals and agencies in the community where you really practice the nursing skills, as well as simulation. Simulation plays a very big part in this program. Simulation is a very good, safe place to learn your skills. You practice, you can see yourself videotaped, you give one another feedback. It's a great learning mechanism by which you physically are doing while thinking, and then you can review your work so that you can then go right back to it and try again till you feel confident. The program can be completed in, I would say, 20 months in reality. So if you start in the summer of this year, you can expect to be finished in the spring of the following. Graduates will be eligible to sit for the NCLEX RN licensure exam. And that, of course, is what gives you the ability to become a registered nurse and work. I think I've mentioned already, classes are held obviously winter, spring, summer, and fall. So this is year round and it is continuous. We do, as I think I've kind of mentioned, a combination of didactic. As you can see, this is a picture of the skills lab. It's the actual larger skills lab. We do have medium fidelity, high fidelity mannequins. We have a home care suite. We have mom, so we can go through pretty much anything. Pediatrics, we can simulate any experience that you need. We use computer generated scenarios that are standardized to help you understand the experience and to have feedback. In-person classes and clinical experiences are conducted locally in New Jersey with partnering institutions. We partner with the RWJ Barnabas system, the Atlantic system, the Hackensack system, St. Joe's. So we have a large number of hospitals, acute care facilities that we partner with. We also work with schools. We work with New Jersey Reentry, because part of nursing is very, very much working with community agencies, because we really are caring for people in the community. So that's part of it. We work with Fresenius, which is chronic kidney disease, as well as a number of different places that work with people with behavioral health problems. Okay. All righty. This was the plan, the curriculum we used for fall of 2020. And it would look different for the summer entrance. We do sometimes change the sequence of courses to go about where we would be. But basically what you can expect when you start, and this is why I say it's full time. The initial semester that you are working with us, you're going to be taking pathophysiology, pharmacology, and health assessment. They're all taught by different professors. And what the professors try to do is keep their systems aligned during the course. Okay, so it's 15 weeks if it's in the summer, and they're keeping aligned so that if you're doing respiratory in one, you're doing respiratory in the other, cardiac for one, the same for the other, because that's really important in building. You've had anatomy and physiology. So now when you start to think about the pathophysiology, if let's say I'll take respiratory, if you're thinking about, let's say someone with asthma, you're learning about the pathophysiology of asthma, which will include the symptoms. Meanwhile, in pharmacology, you're looking at the medications, and the medications that you will be providing are directly aligned with the pathophysiology and what you are trying to reverse. And then meanwhile, you're still thinking about how would you assess that person, because the patho, understanding what's abnormal, will give you what you need to know about the symptoms. It'll give you information where you say, how do I treat this? And how do I know that I'm doing a successful job of treating something? But in health assessment, you'll be thinking about the fact, how do I physically do a complete history and physical exam? But we'll also be able to use the mannequins, the simulators, to give you the opportunity to hear normal and abnormal lung sounds so that you can actually get used to the idea of hearing. What is that? What are wheezes? What are the different objective signs that you will find on physically assessing that person? So throughout this whole curriculum, we keep trying to put it all together for you, and we do work by a systems approach. Additionally, we use what's called Kaplan, because at the end of this, you want to pass the NCLEX RN examination. And this is a kind of review that constantly gives you questions that you will need to pass, because the NCLEX is an interesting test. It will be changing again soon, but it's a test where the questions are written in a very specific manner. So while you will take quizzes, you will take exams, you will write papers and do all of that within the school, and the books and the textbooks will be different. We want to make sure that we're constantly prepping you to know how to take the test questions that will be required to pass the licensure exam. In this, we note there's also a course called Issues. Now, the course called Issues is about policy and leadership. That course is taken with students in the post-licensure MSN degree program. It's one of those core courses that is required for anyone in a master's degree. Looking just through the way this has been written, fundamentals. Fundamentals will always follow advanced health assessment. So if you think of what you learned preceding, now you're going to say, I have to take care of a person. So therefore, I need to have the actual skills that I will need as a nurse. So here we're talking about putting in catheters, starting IVs, tracheostomies, wound care, and everything. So you're again, on an iterative level, you're saying, I know what to look for on a physical assessment, but now what are the actual physical interventions or skills that I'm going to have to do? And so you're never doing anything in isolation. You'll be doing that in simulation, because simulation gives you the opportunity to interact with the simulator. You work in teams and to critique one another and to keep building and to keep remembering. Genetics and genomics. This is where the future is going in terms of pharmacology, in terms of health screening. So we include that. It's important. It's just part of the care we provide, and it's fairly important. Information technology. Information technology, you think of electronic medical records and everything that's going on in our system right now. So this course helps you look at that and gives you the theory behind it. It's very, very useful when you start going into your clinical settings. In general, we will always do, your first clinical course will be med-surg, and that always comes up, and it's called adults and elderly, but that will always follow your fundamentals of professional nursing, because you've had health assessment, you've kind of been practicing the skills, you practiced all that in the laboratory, and now it's time to go out and go to your clinical assignments. I've mentioned we try to keep them within an hour of the university. We try to bring students, we work with students in cohorts. Before COVID, we might put 8 students in a clinical group with one of our instructors. With COVID, we're, have to decrease the number, so we will have maybe 5 students. This all depends on the agencies. We have to work very closely with agencies at this time. But again, you'll go in, you'll be assigned a patient or 2, and it progresses. As you go further up in this, by the time you're done, you're gonna have to figure out how to be able to take care of 7 people at a time in your final management practicum. But we begin slowly. You kind of have to get used to what is your role in terms of nursing, understanding how to get through the record, taking orders down, giving medication. So this is where in a very structured way, you go in, you do it. You always start your day with a pre-brief, I call it. Then you go in, you provide care for the person you're providing care. You're writing your notes. You're actually in the electronic medical records, which is why you all have to get, cleared by agencies before. And then at the end of the day, you have a debrief, and there's usually assignment with it, but everybody kind of talks through what happened, what they learned, what they need to look up. And that's a very big part of learning, is working together as a group and helping each other. So I've said adults and elderly is med-surg. In this particular model, students were also doing pediatrics, and there are different models with that. We sometimes try to put pediatrics together with maternal child, because that's a group, it's about the family, it's about the developing family. So you're applying, again, what you know about it. And meds and pediatrics, again, children are not little adults. There's a whole different, you have to think of it from the behavioral points and what children are in their growth and development, as well as where they are physically. And then childbearing family, this is care of women. It's prenatal care, intrapartum care, postnatal care. Following that, we go to behavioral health, and you're always doing behavioral health as a nurse, so you're going to be getting that the whole way through. But this is when you do your really big deep dive into behavioral health, where you're really focusing, and you are in the mental health settings. They are inpatient, they are outpatient. Sometimes we also have people going in, substance abuse is an issue, so you may be working in that as well. These are all aspects of this type of care. We then have Introduction to Care Coordination, which is where we really try to go through the different transitions. And again, this is just a different model, but that's more making sure you know all the standardized processes that are required for care coordination. You're learning it along the way. Nursing research. Nursing research is a mandatory course for a master's degree. And what we try to do is have people work toward projects, use advanced skills on something that they are interested in and something that will inform their practice. Care coordination always precedes Nursing 608, which is population and global health, because that's one of the situations where you really may be coordinating care. That's when you are in the community. You may be working in rehab settings, some of the assistive livings, definitely out in the community and with agencies. So that's when you really start applying it and you start to say, think of someone who may have had some type of cardiac event. They may be acutely hospitalized. They may then need to go to an acute rehab, to a subacute rehab, and then they have to transition home. And as we know from all the work that's been done from the National Academies of Medicine, and for many is our biggest problems with keeping people out of hospitals and safe happen at these transition points, because that's when one group of care providers kind of hands off to another, and medications, understanding of therapies and next steps can get lost. So this is where it's really important to understand care coordination and apply the models as you're doing population and global health. We do have plans to be able to do it. We do it locally, but we do have plans to be able, for those who wish, to do it internationally. And that's something we were working on and we were hoping to start this year, but unfortunately not. Final thing you do is your capstone. And your capstone is basically spending 3 clinical credits in the field. You get to focus on an area that you really have interest within, and then everybody is in 1 credit in seminar. At that point, you are really doing what I call the Kaplan and the review questions. They become part of your life. There are things that because you were adult learners, we kind of don't assign them credits in the class for, but it's something that we kind of speak of. When you're in the simulation center, we find time to work on all of that. It's really important. And I hate to say it, but going through a program, you want to be able to pass the NCLEX. And we kind of put it in there and try to make sure you do, in addition to trying to provide more. For us, the baseline is the richer, more important information that you need to practice, but 2 separate things: reviewing while you're learning and learning what you kind of need to learn so you're effective. And that's the 63 credits. So application requirements, transcripts from every college you've ever attended. We do say a minimum GPA on a 4.0 scale, a current resume, which gives us a sense of who you are, 2 letters of recommendation, and a personal statement. And the personal statement really doesn't need to be more than a page or so. And it's basically to give us an idea of what you've done, why you're considering doing this, what your expectations are for yourself and how you think you'll manage it and what you would like to do with it when you get out. It is a small cohort group and we try to make sure we can meet people's needs. And that's important for us. Just so you know, it's a holistic review. When the applications are reviewed, they're reviewed by a group and no names are seen, okay? So it's a blinded review for us. Prerequisite courses. So you're coming into this degree and you're going to hit the ground running. So the prerequisite courses are anatomy and physiology. Usually anatomy and physiology is like anatomy and physiology 1 and 2. They both have labs, but then there are other times I know people who've been in bio who may be taking, mammalian anatomy, and then they may take mammalian physiology. That's acceptable. Contact the undergraduate program. The graduate program administrative assistant, that's Ms. Rogers, who will talk to Dr. Vallis. If you have any questions, you can always contact me or Dr. Vallis or Ms. Rogers in terms of questions about credits or individual questions, because a lot of time people do, it's does this meet that? Does basic microbiology the same as applied microbiology? And so questions like that, we're happy to answer for you. Usually they're pretty simple, okay? So the prereqs, as I said, anatomy and physiology. Microbiology with a lab. Micro is incredibly important when we talk about infectious diseases. Chemistry, everything about acid-base balance and understanding the physiology of respiratory and metabolic, really important to have a good chem background. You don't need to have a lab with the chemistry course. Statistics are required because we do research. Human growth and development, that's like a general psych course can be taken, or nursing human growth and development. It's understanding psychology through the lifespan. And then a nutrition course. Christopher, can you advance? I'm sorry. So if you have a non-nurture's bachelor's degree, complete the application, submit, your prerequisites for review, talk to us. You will receive an acceptance from Montclair. I believe this year we're going to start working on the acceptances somewhere in January. You begin the program, you complete the program. As I said, full-time, really intense. You can expect that 1 day a week to 2 days a week, you will be in clinical 12 hours a day once you hit med-surg. And it may be weekends, it may be nights, it may be days. I cannot guarantee it for you. And they're all good things to have experience with, because working a day is different than a night, which is different than a weekend. And then you graduate, you sit for the NCLEX exam, and you become a registered nurse. And that begins the next step in your careers. So as I think I said, summer 21 is the next cohort. The last day to apply is December 15th. We will begin looking at transcripts on January 15th. So if you were taking, let's say chemistry now, and you, if you were taking chemistry now, then you might not be finished by December 15th in terms of having your transcripts. So, but by January 15th, we're going to need everybody's transcripts for all the prereqs, okay? So that we know that you've got everything that you could actually start in the summer. So that's kind of why that was developed that way. If you have any questions, please contact us. The phone is fine. Ms. Rogers picks up the messages, and that's her number, 973-655-3654. And you can see the email, which Ms. Rogers picks up, and then we'll transfer to Dr. Vallis or myself, which is msn@montclair.edu. And of course, we have our website and our FAQs. So, are there any questions? I'm happy to address. Prerequisites, you can find those on our website. I'm just looking at it. Prerequisites, the prerequisites are anatomy and physiology, 8 credits, chemistry, microbiology, nutrition, and a form of human growth and development. Those are on our websites. Is the program accredited? Okay, this is a new program. The program will be going through its accreditation beginning. We are finishing our self-study by December, and we will have our site visit in January. Okay, so it is not yet accredited, but we are in the process. What if a prerequisite is taken during spring 21? Can I still apply for the 2021 cohort? And unfortunately, we're going to have to say no, because if you don't pass that prerequisite, then we would have given you a space that's why we have to have everything kind of together, since we're going to be admitting people as of January 15th. We need to know that everything's together and that you would be able to start in the summer, which is May of 21. So the next thing is, will there be a fall 21 cohort? Is just summer? It's going to be a summer admission. And the reason we are doing summer admissions is that when you look at how many schools of nursing are using facilities in the area, we know that we'll be able to find you placements that will be, we're looking for better for placements where we will not be pushed as much, and we can give you really quality clinical experiences. And we know that during the summer, we think we can do a better job of that. So we're trying to keep it a little bit quieter and less hectic for you, because we do know that you're going to be here full time, and it's a pretty intense experience. when would you start getting acceptance letters? You would start getting the acceptance letters probably about, if we start doing the evaluations in January, I would think sometime in March. Okay. Question, after this program, can I work in an ICU? After this program, if you pass your NCLEX RN, you can work pretty much, you can work where you would like to work, because nurses come in, and if you want to work in an ICU, if there is an agency that will accept you into an ICU, then you would be able to work there. Sometimes it's a really good idea, rather than going immediately into ICU, is to find, which is a pretty intense experience. You may want to start, but you have to see, because right now, one of the things is to try to understand what you like. And the great thing about nursing is you can change and do 40,000 different things along the way. I've been a nurse since '77, and it's been an adventure, and I'm never bored. But the idea being, you may find as you go that you like peds, you may not know what you really like. And part of this, and that's part of the capstone, is to figure out what you like and when you be more experienced at it. And sometimes also to kind of, if you, let's say, like really working at one of the hospitals or agencies, it's to see if we can help you get a placement there during your final capstone. So maybe they'll kind of remember you and want to consider you. The accepted grade for a prerequisite, it's usually B or higher. The process of becoming an APN after graduating from this program, advanced practice nursing, you're coming out with becoming a registered nurse. And so that after this program, if you choose to become a nurse practitioner, then you would go to another program to become an NP. There are programs that are Doctor of Nursing Practice, and there are master's degrees as well. If I'm currently an undergraduate student graduating in May and all of my prereqs are completed, am I still able to apply for this program and be part of the cohort? You would have to have everything completed before May of 21, because you would be starting soon after. So January 15th is the date for having all the prereqs completed. Okay, you're from Ghana and your primary language is English. Please, do I need to take? No, you don't need to take the exam. How many students will be accepted into the summer 21 cohort? I believe it is 30. We are going to keep this small. Again, accelerated program requires a lot of your time, faculty intent. We need to make this so we really are working closely with the cohort of students who are going through this. Okay. Can I further my education in DNP and nurse anesthetist after this program? This program, just like every other one, brings you into nursing, okay? And it is the ability to sit your exam to become a registered nurse. And then after that, should you go to become a CRNA or an NP or whatever else, that's the next layer. And I really seriously say to people, it's very, very important to try. I always suggest that you get experience. You can get a certain amount of experience when you're going through your program, but you really need to work. And you need to get used to the idea of managing things and further finesse the critical thinking skills that you will need to function and to learn more about yourself and what you want to do professionally before your next step. And I do say that very, very sincerely. What is the NCLEX pass rate? I know this program is new, but was it for the other nursing programs? You can look that up on the New Jersey Board of Nursing website or on the National Council of State Boards of Nursing website. What was the first year's acceptance rate? Off the top of my head, I really don't remember. How will real world experience be viewed during the application process? I think it's very important. And again, as I mentioned, this is a blinded review, but you're just trying to present yourself and why you want to do this so that we can kind of help see if we're the right fit for you, because you have to be the right fit for us and we have to be the right fit for you. And that's very important because it's a very big commitment of time on your part. And we want to make sure that we can provide you with what you need. And that's really where we come from on this. You do have lots of options for entering nursing in New Jersey, and I'm sure you're all exploring those different options. And that's very important. The entire program's tuition, I believe, comes to about $48,000. How many applications have been submitted already? I honestly haven't looked. Will being a Montclair alumni improve the chances of acceptance? It's something that we have not put into our, what we do when we're reviewing things. So I guess the answer is no, it's really just about, as I said, grades, activities, and the other things that are on the list. In my state, students are allowed to sign a declination waiver for the hepatitis B vaccine. Will this be allowed for the state of New Jersey? Yes, I know that there is a declination as well. Okay, if the minimum grade on the website says is a C for the prereqs, then that is the minimum grade. Okay, so we always go with the website says and not what I say, because my standards are just way too high. And I'm not one of the people who reviews the applications, just so you know. Is there a time frame for the prerequisite, like how old a science class should be? I would say to you for that, I would really recommend you contact the program director and talk to her individually. There are certain questions that I really recommend that you speak with someone about. And that would be the program director for these individual kinds of things. Upon completion of this program, okay. Is the 3.0 GPA only based on a bachelor's degree, or will prereq courses be taken after degree be taken? The 3.0 GPA is about the bachelor's. The next court after May of 21 will be May of 22. Do you look at the prerequisite GPA or overall GPA? We generally look at the overall GPA. Previously get a question about having gone to Montclair before, that does not influence the decision-making process. Upon completion of this program, can you do nurse educators or nurse managers? It's amazing how people become nurse managers just by being at work, and they start to, coordinate the unit and move along a pathway in that direction. Nurse educator, we do have a nurse educator program. We chose not to do that for this particular cohort because we feel what our goal is to prepare you to be really great direct care nurses. The educator role goes beyond that, so that if someone wanted to do the educator role, they're always welcome to come back. We may do a certificate or something like that. And I do think it's really important to have the educator role is very, very important. We know there's an educator shortage in New Jersey, but we specifically said when we started this program that we would not go with the education role because you need to get the basic skills down before you can educate others. So it would be premature. You have no background in nursing, just laboratory? Yes, this is a decision to change. And I think that's really what I can tell you. This is, again, many people, and that was the reason for the MSN, was that people come back from this is a career change, a life decision change. And what they learned in the research is that makes nursing much, much richer because of what you bring from your previous work to what you bring to nursing and to people. Christopher, did I catch everything?
You have a couple last minute questions, Dean. Do you want me to read them to you?
Okay, I think I can see them. If you have a 2.99 in your bachelor's and a 3.0 in your master's, can you be considered? Yeah, these are all, yes, you can. Our courses such as pharmacology and physiology, mainly online. This semester they are, because what we're trying to make sure this semester is everybody keeps a distance from one another. We all know about social distancing. But even though pharm is online this semester, we have time every Friday. I think it's about 4 or 5 hours when everybody's in. And the people who work in the line who are master's prepared nurse educators who are working with you in simulation and things like that are actually going over the farm and doing equations and doing meds. So we make sure we always give you hands-on. Again, normally would they be online? My preference would be no, but it depends what is going on with the health of New Jersey. As we all know, we're trying to keep everybody safe. My goal for students right now, and that's why a lot of times I am suggesting to the faculty, and it is always the faculty's decision, that we will do theory online, because if we have students who have to go into the clinical, then I want to make sure that they are safe to go into the clinical, because I want to make sure every student gets their maximum clinical hours and that we don't have to revert to online or to simulation in the center or to virtual simulation, because this is a really serious time. And so we sometimes have to limit our access to one another, because if I bring 11 students into a classroom that normally I would have 25 in, but I can socially distance to have 11 students in that classroom, and there are 5 students who go to a clinical, then I'm putting, if one person gets sick, then I'm putting 10 other people at risk. Whereas if one person gets sick and the only contact they have is with their cohort, I'm limiting the number of people that we will have to quarantine or shut a clinical down for in terms of that. So I hope that kind of makes sense to you. But right now, these are very, very difficult times, and we are working towards safety. And we are saying, we know that it takes sacrifice on everybody's time. So, I mean, I personally, understand when people say maybe it's not the right time to go back or whatever. But yeah, we have had to function and do more things online so we can protect everybody from having interactions with one another, because that's what we're trying to do. So we keep saying to everybody, 6 feet of distance, wear your masks, wash your hands frequently, and what we consider to be safety right now. And I mean, that's really important for us as nurses, because professionally, this is what we're trying to do. And that's why we're trying to keep everybody safe. So this is a difficult time, and things are not as standardized as they might normally be. When will the department know if the program's accredited? Probably in fall of 21. I have a bachelor's, but I'm currently taking the prerequisites. How are those classes looked at? We just look to make sure that they're all taken and how you do. Again, that's the committee it runs through of this. Does having previous healthcare experience improve chances of acceptance? I think it's a part of putting an essay together to explain who you are, why you've decided to go back and pursue this, what you hope to do with it. And a lot of that, it's just talking about yourself and why you've decided to do this. And that may include healthcare experience. There are a lot of reasons. It's making a compelling statement about why you think this would be the right program for you, and why you want to do this. Because it is a tremendous commitment. I make no bones about that. Okay. When we say the program's not accredited, what does that mean? Okay. What that means is the program has been approved by the President's Council of New Jersey. The program is approved by the New Jersey Board of Nursing. There is also what we consider voluntary national certification. We applied to the Commission of Collegiate Nursing, the Collegiate Commission, CCNE, Commission on the Collegiate Commission of Nursing Education, or something like that, okay? It's called CCNE. And what we do is we say we want to apply, and it's a very rigorous process by which you do you write what's called a self-study. You give them all your minutes, you show them documentation, and you write all of this up, okay? And then they have a group of site visitors or evaluators who come, they review what you've written, they look at your minutes, they talk to the president of the university, the provost, the registrar, the faculty, the students. They talk to everybody. And then based on their review, they write a report. And then they have a board that writes a report after reviewing their report. And then another board writes another report. And then the Board of Trustees reviews the report. And based on that, your program is accredited. Programs are accredited the first time for a maximum of 5 years, and thereafter they're accredited, if you get the max, for 10 years. Generally, what you try to do, and I've done this a number of times, is you want to have a certain body of information available to the accreditors when you write your self-study. So you always write your self-study before you graduate your first class, which is why we'll be submitting our self-study in December. We are expecting a site visit in January. And for all the boards to review this, we will not hear until October of 21. It is a process. And that's what not being accredited means. But we are recognized by New Jersey and the President's Council of New Jersey. This is national voluntary, and it is a part of the process that I think is very important to do, and we are on time and on schedule for the way we work the process. Will students who obtain the direct entry master's program be eligible for CCTM certification? You have had a good background in it, you will be prepared, and I have to say at this second, I can't remember how many clinical hours you need, but I think you're going to need a certain number of clinical hours. So that's something you could always write me back and I'd have to look at it. But there's a certain number of clinical hours in practice that you need before you can sit the exam, if I'm thinking correctly. It's not one I can answer today, but I'm happy to look it up. So yes, the acceptance decision is based on more than just a GPA. So yes, next question was the prerequisite human growth development. Is it the same as lifespan developmental psychology? Yes, definitely. It's just at Montclair. Yeah, it's exactly the same. And if you have any questions about that, what you can always do is send the graduate program administrative assistant or the graduate program director or, me, a note that says, I was thinking of taking this course. And what you do is it's like, let's say it was I forget. Let's say it's even Bergen for some reason or something like that, because this is a 200 level course or even a 100 level course. So that what you do is you just take the course and you put the course description in and send it to us and we'll just check it out and say, yeah, this is fine. And that's perfectly reasonable to do. Okay. Can we have biostatistics? You can have any kind of statistics as your prereq. Yeah, biostats is fine. Business stats is fine. Psych stats is fine. Okay. Developmental psych from MSU would count. Does this program offer assistantship opportunity? No, it does not. Are there scholarship opportunities? That depends on what's going on externally. At this moment, I'm not sure that there will be. Question about starting at one university, transferring to another. How will GPA be looked at? It's all cumulative. And again, these are more individual questions that I can't really answer. I would recommend certain questions. Ask the program. I would send a note to the program director. Okay. How does the school help with job opportunities? By going through the program and going through the clinicals, you will actually be learning. We do have career services, but just by going through the program, we kind of create relationships with the different hospitals. I mentioned the capstone. So sometimes someone can say, I'd really like to work at X hospital when I graduate, and we'll actually contact them and say, we've had this student, do you have, a med surge or something there, because the person is really interested in perhaps, joining your workforce when she graduates. And believe it or not, hospitals, and I'm talking hospitals only because a lot of people think of hospitals as their first job. And certainly Capstone is always in an acute care facility because it's very helpful. Remember, 75%, a lot of the questions on NCLEX will be related to adult med surge. And so we try to make sure you're really solid and up to date in that information as you move forward. So yeah, a lot of times, remember, agencies and hospitals want to recruit people who are interested in them. So a lot of times, if they know someone's interested in them, they will work with us on this. If you want to become an RN, you want to work in psychiatry, then again, you go through a program. You've got to get the basics down. What this program does is it gives you everything you need for the basics entry. Again, more knowledge about care coordination. And then as you start to make out job applications, you can look for positions in psychiatry. And as you're going through your rotations, if this is something that really appeals to you, you make connections and you speak with people. If you have already submitted an application, Someone's asking, who submitted in early September, it will not be reviewed until January 15th. That's when the committee is going to sit down and start working on the reviews. And again, blinded review, and they're just looking to go through. Okay. Is there a specific chemistry that has to be taken? It could be any chemistry, basically any chemistry. And if you have a question about it, again, my comment, take a look at the one you want to take and make a copy of the course description and say, will this meet your need? Will this, apply? And someone will get back to you, okay? I would, again, prerequisite classes, I would recommend they have a C, okay? Because we would not take a C-. If you were in the undergraduate program and you had a C-, you'd have to take it over depending on the class, in a prereq. Have I gotten to everybody's questions? In that case, thank you all for joining me this afternoon. Thank you, Christopher, for running everything. And I wish you all the very best of everything. Please don't hesitate to contact us. We're around, okay? Thanks, and take good care.